Good morning, everyone, and welcome to the Center for American Progress. This morning's program will be starting in just a few moments. If you all could do two things for us, please. First, silence all cell phones. Secondly, there will be a question and answer portion at the end of the program. If given the microphone, please state your name and affiliation and ask a brief question. Thank you.
Good morning, everyone. My name is Neera Tandon. I'm president of the Center for American Progress. On behalf of CAP, everyone at CAP, I wanted to welcome you all to this critically important conversation. Today, more than 40 million adults in the United States are living with a diagnosis of mental illness. Yet, despite our country's pressing demand for mental health services, less than 4 out of every 10 Americans receive the support they need. To make matters even worse, this crisis of mental health may become exacerbated by the continued attacks on Medicaid and the Affordable Care Act, which have been vital resources for people with mental health needs. In the absence of national leadership, we have leaders at the state and local level who are really taking up the fight and doing more than we've seen ever before. That's why we're really honored to host this conversation and to welcome our very special guest today. Each of them has made deeply personal and impactful commitments toward expanding mental health services within their communities. They've both addressed mental health services and mental health treatment from a global perspective, addressing really all the needs of people who have these challenges. As First Lady of New York City, Chirlane McCray has launched Thrive New York City, a bold initiative that's transformed how the city approaches mental health with really incredible results. Meanwhile, Darrell Steinberg first revolutionized California's mental health system as a member of the state Senate and has continued to serve as a tireless champion on this issue as mayor of Sacramento. So it's really my honor to have you both here. And I really appreciate all the work you've done on these issues. And so I look forward to a great discussion. So I'm just going to jump right in. Really, just before we get started, I wanted to ask you, Mr. Mayor, about the Attorney General's announcement. This is an issue that affects, obviously, both New York City and your city of Sacramento, as well as so many. We know that the Attorney General is going to Sacramento. I know you tried to get there, but because of travel limitations, as you can see, you are thankfully here with us. I wanted to just give you a chance to discuss his efforts, which he's suing California over the state's laws to protect the rights of immigrant communities. He's attacking quote-unquote sanctuary cities. Would love to have you just address that.
Well, thank you, Neera. Thank you so much. Wonderful to be with you and the First Lady. It's an honor, actually. So I'm glad to be here, although a lot of my constituents are going to be out rallying as the Attorney General makes a speech at 8:15 Pacific Standard Time in which we're told he is going to announce a major lawsuit against the state of California for the California Values Act, which is our Sanctuary State Act. And of course, Sacramento is a proud safe haven and proud sanctuary city. And this is just another chapter in a continuing effort to intimidate not just local and state elected officials. We're fine, we can handle ourselves. But more poignantly, to attack dreamers and hardworking families who are just trying to make their way. And our response is consistent and it is clear. We will not retreat. We will not cower. We will not be intimidated. We will fight their lawsuit. They don't exactly have a great track record when it comes to their efforts to impose their will through the courts. And, you know, I think about history very briefly. I think about, here's why I'm optimistic. The numbers of people in 1942 who stood up when the government decided to intern Japanese Americans was minuscule and minimal. 2 no votes in the California legislature against the resolution to support internment of Japanese Americans. Now it's 2018, and despite the troubled times we live in, people are speaking up. There is no more silence, and that is very, very heartening to me. So my community is going to rally. We'll defend whatever this frivolous lawsuit is, and we will continue to stand for the best of American values, which is inclusion, diversity, recognize immigration as a great strength, and protecting people who want to work hard. Last thing, you know, the ICE director said that for sanctuary states and sanctuary cities, there will be collateral arrests. What an outrageous thing to say. I say this. The only long-term collateral impact will be the shame visited upon an administration that chose to divide and sow discord and make the lives of hardworking people harder than they had to be. So we stay strong. But I'm glad to be here.
Thank you very much. And thank you for your leadership. I know Sacramento and New York City and a range of other states have really shown incredible leadership, as ICE has been really heartless in what it's doing. So, but the purpose of today is to discuss mental health. And I'd love for you, First Lady McCray, to really describe the Thrive New York City program as an incredibly innovative program to really look at the whole parts of the community and the person. And so if you could just really share with the audience, you know, how it works, and then the impact you're seeing and why you chose to focus on this issue.
Hey, those are quite a few questions.
I could do some follow-up if we need to.
All right. Let me first say that Thrive is it's not really a program, it's a framework, a public health approach to mental health services. And our goal is to change the culture and to change the way government delivers services. And the framework, we came to this framework over a period of 11 months. First, we wanted to engage the city, engage the members of our city. So we went out and we talked to everyone. I mean, we talked to parents, academics, consumers of mental health services. We talked to teachers, police officers, everyone we could, to understand how they regarded the services that were offered and how they did or did not improve their lives and the lives of their family members. And that is how we came to this framework, which is really 6 principles. Change the culture, act early, close treatment gaps, use data better, strengthen government's ability to lead, and to work in partnership with communities. Those 6 principles really are what governs all of the programs that make up Thrive. Thrive is 54 different programs, and so all of those programs are reflected in one or more of those principles. And I like to ask the audience a question when I start out, which is, how many of you have been affected directly or indirectly by mental illness or substance abuse? Please raise your hand. All right, there you go. I think almost everyone put their hand up. And I can tell you, if your hand didn't go up, then it is quite likely that you just don't know your friends or your family as well as you think you do, because we are all affected by this. And those of us who may not be affected directly, just think about, you know, your friends, your family members, your neighbors, and the anxiety and the stress that comes from dealing with someone who is suffering, someone who's not getting the treatment or services that they need. We recognize this. The statistic is 1 in 5 adults, 1 in 5 children suffer from a mental illness in any given year. That means, again, we are all affected by this. So this framework, these 6 principles really help us to figure out, okay, what do we need to provide? What do we need to do differently? And we have programs in all of our schools. All of our schools now have some type of mental health support. We have partnerships with community, which I will tell you about a little bit later. And we have we've begun training our police officers and our teachers, and so that they are more able to recognize the symptoms of mental illness and substance misuse and actually do something about it, respond appropriately. So this is a very ambitious program, very difficult to summarize in just a few minutes, but it also recognizes that there's no one size fits all.
Right.
Obviously, New York is a very big city, 8.5 million people with all different types of communities. So there's a huge flexibility in our programs and with the framework that we have put together, which means that it can be duplicated. It doesn't matter whether it's a city of 8.5 principals or a small city of 40,000. This framework was really able to be replicated in other places.
That's fantastic. I'll follow up with additional questions and give you the chance to talk a little bit more. But I'd love to, about different aspects of it, but I'd love to ask you, Mayor, you've been a longtime advocate in this arena and have shown incredible leadership in the state. At the state Senate, you passed the Mental Health Services Act. What can you talk a little bit about what the act was about and why you've taken on this leadership role?
Thank you. I have a personal story which has been public, but I tell the story in maybe a different way than the audience would expect. I have a 23-year-old daughter, Jordana, who is doing great, by the way, who, as a child, lived with a significant mood disorder that had an impact, obviously, on her and our entire family. And when she was 13, my wife and I made the toughest of decisions to send her to residential care and treatment, where she spent most of her teenage years. When she was 19 years old, she decided that she wanted to tell her story publicly. I had never talked about it publicly, even though I was doing the mental health work during that period of time. And her story, front page of the Sacramento Bee back in 2014, really touched a nerve. And to this day, there isn't a week that goes by where my wife or I don't get a phone call or somebody stopping saying, I have a similar story, we need some help, what can we do? It's more common than we know. But I begin that way because people think that's what motivated me to take on the mental health issue, and it's not true. In 1998, I was a freshman member of the state assembly, and definitely green, didn't know any better, and I introduced my first bill that said we got to spend $350 million to combat homelessness and get 50,000 people off the streets around mental health. And at the end of the legislative session, I declared victory when Governor Davis signed the bill that had $10 million in it. But it was so successful, our 3 pilot projects to provide integrated services to the homeless mentally ill, that we expanded it to $55 million. And then in 2004, we had another audacious idea to go to the voters. In California, we have the initiative process. And we put forward, I think, the first millionaire's tax in the country, Proposition 63, a 1% tax on adjusted earnings above $1 million. And it passed with 53% of the vote. It was a popular tax, but it also passed because people, I think, in California had the number of hands up that the First Lady inspired here is true throughout society. Everybody knows somebody. We passed 53% of the vote. Prop 63 is now generating $2 billion a year for the public mental health system in California. 25% must be spent every year on prevention, early intervention, and innovation, which is the key. So I started all this work when my daughter was 5 years old, before we knew that we had issues. And it makes the larger point, which is that this is not just about the homeless. They're the most visible manifestation of untreated mental illness, but it is about all of our families. And this is, to me, and I know the First Lady agrees, the unaddressed issue of our time. And to lift this issue up to be a public health and healthcare priority is, I think, our common mission.
I'd love to actually just follow up on that with you, First Lady McCray, which is that there's been really a revolution in this conversation around mental health. I mean, it's not a revolution that's fully resolved, but a revolution. I mean, if you think over the last several decades, there's been incredible stigma around the issues of mental health, and a much broader discussion recently and in more recent times about how mental health is like physical health. There's a physiochemistry to these issues, that we have to treat it in a similar way. I'd love for you to just share your thoughts on that change, how you talked about in the Thrive New York City program, how it's a critical component is the public and public support and public perception and public action. And I'd love for you to give your thoughts about how much change has occurred, but what we can all do to hasten that change.
Well, change the culture is, our first principle, and I'm so happy when people share their personal stories. I have a personal story as well. Growing up with parents who suffered from depression, and our daughter has also shared her personal story. But those two things are not the reason why I have taken this on. I've taken on mental health and substance misuse as my issue because I see the huge waste, the lack of productivity, the suffering, something that we can do so much to change. And we are changing the culture, all of us, by having this session here today. In New York, we are working with clergy, our clergy members. We're working with all different service organizations. We are working with it, working on changing the culture in every possible way that we can. I think all of our programs do something to change the culture around mental health. And one, it's about about sharing our stories, but it's also about educating people. Because if there is political will, if there is organizational will, if there is that will to make change, but we have to do it with some understanding of what actually works best. Something that we're not seeing from the White House and many leaders. We have to so changing the culture can be accomplished through getting people to take mental health first aid. Our goal is to train 250,000 New Yorkers in mental health first aid, which goes a long way to helping people understand the signs, helping them learn how to respond appropriately. I always say, look, we grow up learning what to do if somebody's bleeding.
Yeah.
Right? We all know what to do. You clean the area around the wound, you find a bandage, a clean bandage, and apply pressure if the bleeding doesn't stop. We all know that, but very few of us know what to do if someone has a panic attack or if someone is suffering from depression, won't get out of bed in the morning. We just don't learn that. And mental illness and substance misuse are so much a part of the human condition. That the urge to self-medicate if we don't feel right, the mood disorders, but we don't know what to do. So mental health first aid is a huge part of our strategy to get people to know the signs so that we can act early. We don't want people's disease to go so far so that we see people on the street, so that they're in jail or in and out of our emergency rooms. That's a sign of untreated mental illness, the fact that people end up in those situations. But we also know the average waiting time between symptoms emerging and people actually getting treatment is 10 years. 10 years. 10 years. If we let someone with a heart condition go for 10 years, or somebody with asthma or diabetes, it doesn't get better. So we have to get our populations educated so that all of us understand what we're seeing and can get people to treatment earlier, because we know that it's all treatable. We can improve people's lives if they just get the appropriate treatment.
Thank you so much for that. And I want to follow up with you, Mayor, which is that what the First Lady is describing is really thinking about this, obviously medically, but also as a public health issue.
Yes.
And, there have been recent transformations even on that and within the medical profession, which is to recognize symptoms early, not let those 10 years go by, where things can radically alter things. Early prevention and early treatment work in the mental health space as well as other spaces. So I'd love for you, Mayor, to maybe talk about your experiences in California, how California has shifted, the kinds of things that are happening in the state and in Sacramento from the changes you've helped bring about.
Well, I appreciate that. I am definitely a glass half full person. And I have great hope.
If you're in Washington a little bit, we'll cure that for you.
We'll cure it for me quicker. That's why I'm getting out today. I think I want to focus just a second on the empty part of the glass, because what really is lacking around these sets of issues now is we need more Chirlane McCrays and more Bill de Blasio's. We need more leaders in high positions of power making mental and behavioral health and substance abuse disorders a public policy priority. Now, it's happening a little bit with the opioid crisis. But here's the truth about mental health. It is always the secondary issue to something else. It's the secondary issue to criminal justice reform. It's the secondary issue to homelessness. It's the secondary issue to school-based shootings, and how cynical it is when that's the only time the issues of mental health are raised. What we're trying to do in California, I left the legislature and I have a different leadership position, but I started a foundation, an advocacy institute, that is centered on trying to enhance public leadership around mental and behavioral health. Because until we hear a different president of the United States, governors, more mayors say that this ought to be the fulcrum of our advocacy, and this issue ought to be the centerpiece, we won't be there yet. And most politicians, by the way, don't believe that working on these sets of issues is either worthwhile enough or politically advantageous. And I didn't become president of the Senate because I worked on mental health, but it certainly shows that you can attain positions of leadership. You can become mayor of New York, making it part of the centerpiece of your agenda. I really think leadership is important, and it's lacking by and large. And so we haven't yet hit that tipping point. And the First Lady cites a number of examples of when you step back and think about it, it's kind of shocking. If your loved one has a heart attack, God forbid, and rush to the hospital, there's no question that there's a bed. In California emergency rooms, people languish for 24, 36, 48 hours or longer in a gurney because there isn't a bed for a so-called 5150, what we call it in California, a psychiatric patient. You see somebody bleeding on the street, you stop. We all are too busy to stop and help the numbers of homeless people that are on our streets oftentimes. You come back to work after cancer, now 30 years after that was stigmatized, you talk about it. You come back after a episode of bipolar disorder or something, man, you're less likely to talk about it. It could affect your status at work. So I want to celebrate the achievements, and in California, $2 billion a year has saved the mental health system. We're innovating in great areas, you know, early psychosis identification intervention, I think the most hopeful practice for teenagers. Prevention and early intervention must be the coin of the realm here, because we're never going to catch our tail on the back end, although we have to help, obviously, as many people as possible. But there is more work to do to cross that tipping point and make mental health the mainstream issue that it deserves to be. And it's all about leadership. We know that in our positions of, quote, power, for limited periods of time, if we choose to breathe life into something, it has a much better chance of happening. We need more public officials to make this their priority. And finally, so I got my soapbox here. Finally, we as advocates need to play the game of politics around holding candidates and public officials accountable for making these sets of issues a priority. This isn't just a feel-good, wouldn't it be nice if they worked on that? Where are PACs and organizations and others saying, we want you to work on mental health? Thank you.
That's great. I would love just to follow up with you, First Lady McCray, on that particular issue, which is, again, you are transforming the culture and doing so much there. I'd love for you to share with the audience some of the successes of the program. I think it's really important that people see that this is an area where we can have real shifts, and that when we think about this from a health perspective, then it can really make profound change. So I'd love if you just could share some of the impact you're seeing from this focus in New York City.
Well, first I want to say I agree with you 100%. We need leadership to engage in this issue much more deeply than they are. And I think that they just don't understand. I think that leadership, especially elected leadership, they're so accustomed to being reactive, reacting to homelessness, reacting to the number of people in jail who are suffering from jails and prisons from who are suffering from a mental illness or substance abuse issue, and it's very much about reacting to what we can see and touch and feel, whereas we would have so much of a greater impact if we were dealing with acting early, prevention and intervention, and that's tougher because elected officials tend to serve for maybe 2 years, 4 years, maybe 8 years, and not much longer. And also because they do not understand that which they cannot see, because going back to what I said about us not getting that early education about what is mental illness, what is addiction, and if people truly understood the impact that it has in all areas of our life, maternal depression, our schools, so many of our children walking into schools, and by the way, the symptoms of mental illness and addiction emerge in half the time, 50% of the time, by the age of 14, by or before the age of 14, and 75% of the time by the age of 24, which means, why aren't we paying attention to our young people more? Why aren't we giving them the support that they need and helping them get to treatment earlier? We can do so much if leadership would just recognize that, not only that we can help people be well, but recognize that it has long-lasting consequences that will save them money, save us all money and time if we just address it earlier. Now we have great successes in New York City with ThriveNYC, but it's early. Yeah, we've only, it's really in its infancy. We've only been up and running for 2 years. In that time, we've been able to train more than 50,000 people in mental health first aid, which I think is amazing. Our goal is 250,000, and we are ahead of our target. So I feel very good about that. I think it's going to go a long way to changing the culture and growing the kind of leadership that we need to make those big changes. And because our emphasis is on community leaders as well as people who we call first responders. We've been able to, we have a collaborative of hospitals, 30 hospitals who are working to address maternal depression, which is much more prevalent than people realize. Some of the numbers say 1 in 10, 1 in 12. Of course, that's higher in some communities. We've been able to convince our primary care doctors, pediatricians, people who don't normally ask the questions around depression, to screen women and to connect them to care if necessary, which means that we have affected thousands of families already. Because if maternal depression goes undetected, it has lifelong consequences on the child. I don't know if any of you have ever seen a video of a woman who is depressed sitting with her child and what that feels like for the child. It is, let me tell you, it moved me to tears to watch the lack of interaction and the anxiety that it provoked in that baby. But we can, and we know that we can prevent this. We can treat it. It's very not that challenging. It just means changing the way we do work that we already do. Getting those pediatricians to ask mothers, pregnant women, how are you feeling? And getting them to the treatment that they need if necessary. So those are a couple of our successes. We also have some form of mental health support in all of our schools. We don't have the kind of data yet that I would like us to have, but we have 400 different metrics we're using with all of our Thrive programs. And so we're very focused on making sure that we can prove outcomes in every one of these programs, because we know that if we don't have that data, that we're not going to be as convincing to other cities that need to.
I just want to tell everyone we're gonna take questions in a minute, so start getting those ready. But
Can I just say
yeah,
on
please.
outcomes, because I just want to reinforce that point. Outcomes are so important because one of the ways we bust stigma is to convince policymakers and the public that people do get better. And in California with Prop 63, we've helped tens of thousands of people with serious and persistent mental illness avoid homelessness or get off the streets. We know what works. It's assertive outreach, it's case management, it's mental health and substance abuse services, it's temporary, what we call triage housing, and it's permanent supportive housing. And if we apply those principles, as we're doing in California, to scale, we can help tens of thousands of more people. We know what works on the prevention side. Prop 63 is piloting some of the most innovative prevention and early intervention strategies, including this early psychosis identification intervention. The idea is simple. For the 14-year-old who has the family history or is acting in ways that create concern at school or at home, that early intervention with intensive family therapy, lower doses of medication, are proving to obviously provide better outcomes for people, for those young people, than those who don't get the help and have that stereotypical first break, either in college or end up going through the system. We know what works. And so outcomes are so important because to tell that story, the human interest story, but also the data, that also motivates leaders to say, we ought to do more of this.
Yeah, I'll just quickly follow up because the First Lady mentioned this and now you're mentioning it, which is, in this arena, I think one of the questions that people really ask is, it's so obvious on some scale, right? If you invest early, just in anything, if you invest early, but in this arena more than others, if you invest early, address treatment early, you can really reduce costs across the board. Obviously, we've talked about the criminal justice system and homelessness, but there are a wide variety of supports that if you have a treatment plan, you can avoid. So I think it is one of the interesting things, whether it's been stigma or lack of public conversation, where the sort of dollars for investment make so much more sense. I think that's one of the reasons why you see doctors now coming out saying, you have to have your early warning system for mental health, just like every other issue. And
if I may, what's interesting politically is that we're beginning to see the doctors, the California Medical Association, the Hospital Association, some of the major players beginning to identify mental health as a priority because they're recognizing that they can't keep up and their systems can't keep up with only addressing people who have fallen on the hardest of hard times. And so that's what's most hopeful to me when sort of the conventional mainstream political stakeholders begin saying this is a priority, combined with elective leadership, community-based leadership, and the best ideas, that gets us closer to the tipping point.
That's great. All right, we have time for questions. Billy's going to take the mic around. If you have a question, just raise your hand, identify who you are, and we are really pushing towards actual questions. So.
Hi, my name's Gabby Vasquez, and I'm an occupational therapy student completing my fieldwork at the American Occupational Therapy Association. I'm also a Queens, New York native, and I love being from Queens because it has given me the unique ability to recognize how different systems of oppression really impact you if you do have a mental illness. So while I completed one of my field works at an inpatient psych unit in New York City, I saw a lot of my patients in and out the door, even though I was only there for 3 months. And I think a lot of it had to do with them not being able to complete their independent living skills. So as an occupational therapy student, that's something that, we focus on in our curriculum. So for First Lady McCray. My question is if you've ever considered having occupational therapists join in your Thrive's New York City program or framework.
I think it's a fabulous idea, and we would love to talk with you. I think that there is a role for occupational therapists and many of our different types of health providers to do this work. We call it task shifting, and we actually have a program called Connections to Care, where we have 15 community-based organizations who do different types of work, like whether it's training, do employment training, for example, or daycare centers, or working with underemployed young people. We have a mental health partner for every organization, and they're training the staff to recognize the symptoms of mental illness, substance abuse, whatever it is, and actually work with them. And if they need a higher level care, they work with the mental health partner. Why is this so important? Because people don't want to go out to a hospital or a clinic to get help. These neighborhood organizations know the people in the community. They're trusted by people in the community. They speak their language. People are going in there for other types of skills, like maybe occupational therapy, but at the same time, the staff is able to recognize and treat whatever else it is that is plaguing them. And I love this because, talking about outcomes, the staff at these different organizations have recognized that 1 in every 3 of the clients who walk through their doors actually has some type of mental illness or substance abuse addiction. So that it is, we've already proven that this is a successful approach, and by training people like you to get more skills, training in psychoeducation, motivational interviewing, mental health first aid, that you can actually have an even greater impact with the people that you are working with.
Right. Other questions? There's one over there, and then we'll go over there.
Good morning. Thank you all for your presentation. I really enjoyed it. My name is Kevin Detner, and I'm the founder of Henry Health. And Henry is a new digital app and platform that we're building designed to provide self-care support and mental health services to Black men. One of the things that I didn't hear come up today was the use of technology. Mm-hmm. And I also heard a lot of responsibility placed on the leadership of policymakers, but I'm intrigued about your thoughts about what we can do from the private sector and how we can also use technology. Thank you.
Well, I think technology has a great role to play. I didn't talk about it, but we are actually doing quite a bit there. We all have a role to play. You know, every single one of us in this room has a role to play in addressing this crisis, this public health crisis. In terms of technology, I can tell you, I know Philadelphia has done quite a bit with their Healthy Minds initiative. They have a whole online platform that people can access to learn more about mental health, but also to help themselves, to help veterans, anyone who's suffering, to get better. In New York, we're actually working with CUNY. We have an innovation lab set up to work as technical assistants, but also to help us figure out like how we move forward in helping people with e-health, help people with, especially our college students, with various apps that they can use on campus to help them with their mental health. We have a variety of programs that use technology. I don't think we're where we want to be yet, but I think the best example is our virtual learning center, which we created for clergy members and for community-based organizations who want to know more about the people that they see every day that need their help, but they don't know enough. So we've established this virtual learning center that they can access for free with modules that we are continuing to build, so it's always a work in progress, with the information that they've asked for, the information that they need to do their work.
So we have one of the great challenges in this field is that we have a severe workforce shortage. in mental health. And so it makes technology, telehealth, e-medicine, whatever you call it, even more important. And of course, Sacramento is about 2 hours from the Silicon Valley. And the Silicon Valley, it's interesting, are hard at work trying to develop technology to improve mental health care. And some of it's untested, but there's a organization called Mindstrong, for example, that has gained some significant equity investors. I'm going to take my phone here for a moment. This is a little out there, but it's really interesting. They're developing an app where if somebody has had a break and you want to prevent the second break, the app connects the individual with their psychologist, psychiatrist, physician. And the app looks at their cell phone usage over time, not the content, but how they use their keyboard. Are they writing faster? Are they misspelling words that they previously had not misspelled? 25 different sort of tests over the course of 2 to 3 weeks where the psychiatrist or the treating physician can tell whether or not they're off their baseline and ought to intensify their support and help. There's significant investment going into this kind of app.
A little scary.
It's a little bit. I'll opt in, right?
I'll opt in.
I'll opt in.
Yeah.
But it gives you a sense that over the next 5 to 10 to 15 to 20 years, that figuring out the appropriate ways to protect privacy, but to use these kinds of devices to enhance care is coming.
Yeah, I guess I would also just add, I think it's great that there are other technology, that you're working in technology in other areas to address this problem. I think we have time for one more question. Just identify yourself.
Hi, I'm Annie Leompore. I'm with the National Coalition for the Homeless. Thank you both for being champions on the issue of mental health. I have a question because I work on a national level. How can we get a robust healthcare mental health system on a national scale? My second question is to you, Mr. Mayor. Sacramento has recently been criticized about patient dumping in regards to homeless shelters. Yes. How are you, as mayor and your administration, addressing that issue? Thank you.
Can I go first?
Yeah.
Okay, well, first of all, patient dumping is unacceptable. And there are serious state laws on the books that prohibit and prevent it. I'm trying to both address accountability, of course, but really make some lemonade here. So here's the way I look at it. We need the hospital and healthcare systems to partner with us to fund more triage-based shelter, more funding to induce property owners, landlords to rent to people who need significant supportive services. And sometimes the best ideas are the common sense ideas. We need them to help fund rental assistance programs for people who are living on the edge, who are one injury, one broken down car, one mental health crisis away from ending up on the streets. So what I've said publicly in Sacramento, not just to the healthcare systems but the private sector, and I know we're a different scale than New York City, I'm going to raise $20 million to complement what we're doing on the public side to provide these interventions so that there are alternatives for people who are leaving emergency rooms. When I was in the legislature beyond Prop 63, I authored SB 82, which is funded a couple $100 million worth of program for alternatives to emergency rooms. The emergency room should not be the place where people get care and treatment.
That's right.
And it requires public-private partnership to enhance our capacity to do more of that. So that's what I'm doing.
Do you want to talk about the issue of how we get a national system to address these?
Yeah, well, I want to talk about Cities Thrive, which is a coalition of 200 cities, more than 200 cities, mayors, thought leaders, organizations, big and small, who have all united to share best practices, to advocate for better integrated care system and get funding to mental health programs. We have conference calls monthly We have days of action. I was going to be meeting with, I've been to Washington, D.C. 6 times in the last couple of years. I was going to be here all day today to meet with members of Congress to ask for funding and for prevention, specifically for prevention, because they've got this big emphasis on serious mental illness. We have to do more than that. We all can do this. We all can call our Congress members and ask that we direct the funding that has been appropriated already to mental health care. There's talk about the opioid epidemic, but the situation is even bigger than the opioid epidemic, and we want to make sure that we are acting early to get the care to people when they need it. Before the disease gets more serious. I also want to bring up our annual weekend of faith on mental health. I think this is a way we get people to share stories on an even bigger scale. We get to teach people more about mental illness so that they have the information they need to talk to their Congress members. We are the third year we've had this weekend. We engage our clergy members at synagogues, mosques, temples, everywhere, just to devote part of their services to talking about mental health. We provide talking points so they know what to say, and we have this learning center so they can learn and get more information. We have conference calls so the clergy members can figure out what they want to focus on for their congregation. This is helping to change the culture and to actually help normalize the conversation about mental health. And we need this. We need people to have these conversations with people that they trust and get a better understanding of mental illness and addiction on the ground. That will go a long way to helping us change the culture and get our leaders to understand the changes that have to be made. They've got to feel the urgency the way we do.
You want to just
Can I just end, we're here at the Center for American Progress, and I want to invoke the name of John F. Kennedy and then Ronald Reagan, because history tells us a few things. In 1963, months before the tragedy in Dallas, the Congress passed and the President signed the National Community Mental Health Act. And there was a promise from the federal government that in closing federal and state mental hospitals, that we'd fund a decent system of community mental health. In California in 1967, then Governor Reagan signed what's known as the Lanterman-Petrus Short Act to shut state hospitals. I went back and looked at the typewritten Department of Finance report from 1967. And then Governor Reagan promised, and the legislature was bipartisan, said that the state would fund 90% of the cost of community mental health care. And both at the federal level and at the state level, those have been promises largely unfulfilled.
Right.
It is now 50 years later, and so it's time to fulfill the promise. And what is it going to take? It's going to take national leadership. And I think now it's trying to maintain what we have, frankly.
Oh, no. President Trump is talking about opening up the asylums again. And
yes, he is.
Which is like going backwards.
Which is horrible.
And expensive. We spend $150,000 to take care of a patient in an asylum as opposed to $30,000 to working with them in the community. It makes no sense.
You're absolutely correct. I mean, it's one flew over the cuckoo's nest was kind of true. And we never want to go back to that time. But we have to keep working to prepare for that day when we will have leaders, more leaders, including a president of the United States that is ready to commit to fulfilling that 50-plus year promise.
Fantastic. We started this conversation with the need for national leaders, and we are lucky to have both of you as national leaders who are focusing on this problem that affects, as you can see, almost every American. So thank you so much for being here at the Center for American Progress, but more importantly, thank you for all you're doing to improve the lives of so many people.
Great honor.
Thank you.
Thank you, Mary.
Thank you.